Sjögren syndrome is a chronic autoimmune disorder that destroys moisture-producing glands, primarily causing fewer tears and less saliva, resulting in dry eyes, dry mouth, and oftentimes fatigue. It mainly affects women ages 50 to 60, often accompanying other autoimmune conditions like lupus. In autoimmune conditions, the body attacks its own tissues by mistake. While no cure exists, treatment involves symptom management, using artificial tears, saliva substitutes, and medications with a generally manageable prognosis. The condition may happen with other autoimmune system conditions, most often rheumatoid arthritis and lupus. Today on your favorite Health TV talk show, The Physicians, we'll be discussing Sjögren's syndrome, the unusual cause of dry eyes and mouth. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbere, your regular anchor on this program. And today, my co-anchor is not around, so I'm going to run the show alone. In the studio with me is our wonderful, cerebral, always giving it all to us. He is, in fact, he's one of a kind. We don't have many of them in Nigeria. He is no other person than Dr. Hakeem Olaoshebiko. He is a consultant rheumatologist with the Lagos State University Teaching Hospital. He'll be talking about Sjögren's syndrome, the unusual cause of dry eyes and mouth. Doctor, you're welcome to our program.
It's my pleasure, always my pleasure. Thanks for inviting me.
It's nice having you again.
Yes.
Like I always say, you're supposed to be in the museum because we don't have many of you around. But we're actually very happy and privileged to always have you on our program as on the Physicians.
Yeah.
Sjögren's syndrome, the unusual cause of dry eyes and mouth. Why is it unusual? And what is Sjögren's syndrome? You want to just give us a general overview of what it is?
Yeah, thank you so much, the host of the Physician. I'm always happy to be here to raise awareness on autoimmune disease. Now, Sjögren's syndrome is one of the 100 autoimmune conditions that exist all over the world. It is rare because there are other causes of dryness, dry mouth and dry eyes. So for example, if you have a hot weather or windy weather, you can have dryness of the eye and dryness of the mouth. Aging, people that are older, the elderly, they are prone to having dryness. So medications that we use for something else, like antihistamines or even some antidepressants or even some diuretics, can cause dryness. Even if you're involved in a lot of exercise, you can sweat, and even it can also lead to dryness sometimes. But if you are very dehydrated, maybe you are not drinking a lot of water. So jogging causes dryness though, but it is like the rarest cause of dryness that if you don't have high index of suspicion, you might miss this diagnosis. So it's an autoimmune disease as explained, as I introduced earlier, characterized by our immune system targeting moisture producing glands in our body. We have glands in our mouth that produce saliva. We have glands in our throat that produce moisture that help to swallow our food easily. Yeah. We have even moisture in our skin that help to lubricate and oil our skin. We have moisture in the female women, they have moisture in their private parts that help them to enjoy sex and even do other things. And we also have dry glands in the eyes that help, tear glands that help us, that lubricate our eyes. So any of these glands can be attacked by our immune system mistakenly, leading to what? Dryness complaint. So the dry eyes means that they have dryness of the eye, like sandy feeling in the eyes. okay, or gritty sensation in the eyes. Like the eyes can turn red. They may have photosensitivity. That is when they sight light, they start trying to take a eye away because of pain and discomfort. Then the mouth, they have dry mouth that can lead to they have high level of dental caries because of dry. That they have this tooth decay or toothache because of dry mouth. Sometimes they have sores in their mouth because of dryness. Because the saliva there, God in His infinite wisdom has reason for giving us these lubricants or the moistures in our body. So if there is a dryness of the mouth, then it may even develop dry cough because of that. It can be sore throat. There may be problem with swallowing food or swallowing solid food because of dryness. Sometimes it can cause heartburns because of dryness. Can cause heartburns. Then in the skin, you can have dry skin that can lead to scratching of the skin. It can and then dryness of the private part can lead to painful sexual intercourse for women. So that is the impact of dryness generally. But Sjögren syndrome is one of the rarest causes of dryness. And Sjögren syndrome has 3 components: dryness complaint, 2 is unexplained body fatigue. The person gets tired a lot, and the third one is generalized body pain and joint pain, as the case may be. So if a patient has dryness with overlapping complaint of body pain or joint pain and extreme tiredness or fatigue, it might be Sjögren syndrome unproven otherwise. Sjögren can be generally divided into 2 types: primary Sjögren and secondary Sjögrens. Primary means that patient has Sjögren syndrome in the absence of any underlying cause or associated medical conditions. While secondary Sjögren, or what's called associated Sjögren, means that patient has Sjögren, but there is an associated medical condition with it. For example, patient may have Sjögren and have lupus, as earlier alluded to. Patient may have Sjögren and have rheumatoid arthritis or other overlapping autoimmune condition. Patient may have grave disease, maybe excessive thyroid problem, or even low thyroid function like hypothyroidism. They may also have Sjögren. Patient may have autoimmune liver disease, may also have Sjögren. Patient may have vitiligo, that is an autoimmune disease of the skin, in the way they have like a white skin patches. You may also have Sjögren. So Sjögren is one of the autoimmune diseases that overlap with other autoimmune condition, what is called polyglandular autoimmune syndrome. When you have autoimmune disease, 2 or 3 autoimmune diseases occurring simultaneously or sequentially in one person. You will see a patient with Sjögren with autoimmune liver disease. Liver is affected. You see a patient with Sjögren affecting the thyroid gland. It's a patient with Sjögren having rheumatoid arthritis. So when you see a patient with Sjögren, you need to, a doctor must have an holistic assessment. Beyond that, beyond the dryness. Patient with Sjögren can also have internal organs manifestation apart from the dryness. Okay. So because sometimes they are preoccupied with the dryness, which can be discomforting anyway. But the Sjögren can affect the lungs. It can cause inflammation in the lungs and can lead to chronic cough, can lead to the shortness of breath, difficulty in breathing. It can cause scarring in the lungs called interstitial lung disease that may progressively cause joint lung failure or respiratory failure if it is not detected or treated appropriately. The same Sjögren can affect the kidneys, which can affect the secretory function of the kidney, what they call tubular acidosis, which can affect the kidney function as well. Sjögren can affect the nerves. Patient with Sjögren can have neuropathies, that electric shock pain, pins and needle feeling, tingling sensations, unexplained body sweating because of the nerve damage, autonomic nerve dysfunction. So Sjögren is more of what's called multisystemic or multi-organ disease, but the commonest complaint is dryness. And before you now attribute any dryness you see to Sjögren, always look out for common causes of dryness in our environment. We call them physiological causes. They are not disease per se, but if you are on medications now, or you are an elderly person, or you're not drinking a lot of water, all this can cause, even weather condition can cause dryness. But the dryness of Sjögren will be associated with what? Unexplained fatigue. Dryness of Sjögren will be associated with what? Body pain or joint pain that is unexplained. They may also lose their weight. Sometimes they have progressive weight loss. Sometimes they have fever, low grade fever. And as I said earlier, it is commonly seen in middle-aged people. However, children can have Sjögren.
Really?
Yeah, but it's just as common in middle age. Very elderly can have Sjögren, just as it's common in the middle age. And some, it's a disease of what's called bimodal. Bimodal means that 2 different age groups can be affected. Particularly those with secondary Sjögren, they are young people in their reproductive age, like young women. It's just like the ratio of in lupus. Lupus is commoner in female. Sjögren is also commoner in female. So Sjögren is like ratio 9-1 or 10-1.
Okay.
You know, when you have 10 people with Sjögren, 9 of them will be female, while 1 will be male. The same thing as lupus. So if young people have lupus, they are also more likely to have Sjögren because they can have what's called lupus Sjögren overlap when lupus and Sjögren occur together. As she said earlier, the specific cause is not known. But just like any other autoimmune, there are interplay of many factors: the genetic factors, the hormonal factors, the environmental factors. Genetic factors are proteins and protein causing, gene that cause disease. A lot of us don't have power over that. We get that from our parents that may not even have the disease. They may have suppressive gene. By giving birth to us, they transfer the genes to us. And when the gene now encounter environmental factors such as exposure to sunlight, exposure to toxic fuel or irritants or pollutants or chemical in our environment, all this ozone layer depletion, all these ultraviolet rays get to us, and this interacts with the gene that you have already acquired from your parents. Other thing is previous infection you have had in the past. Okay, that you just took antibiotics. All this especially viral infection. All these viruses. Even COVID-19 vaccines have been linked with a lot of autoimmune disease. People that survive COVID-19, we are now, diagnosing patients with autoimmune disease from previous history of COVID. Okay, because COVID is a viral condition, just like Epstein-Barr virus, Coxsackie virus, CMV virus, mumps virus, that have been linked with autoimmune conditions. So viral infection in the past that is not diagnosed have been linked. So it interacts with the genes. The hormonal factor is because most of our patients are women. They have estrogens. Some of them use pills. Most of these pregnancy prevention pills. All these have been linked with what triggering autoimmune disease. Those that are genetically predisposed. Okay, so interplay of the genetic factors, which we don't have power over, the environmental factors, and hormonal factors lead to our immune system to go into overdrive and start producing antibody protein that now start attacking the moisture producing gland in our body, leading towards dryness and inflammation in organs that are being attacked.
I'm sure my viewers are all wondering, this Sjögren syndrome, we've talked so much about it, the risk factors, the possible causes, and of course we know that it affects women more than the men. So everyone is sitting and waiting. How is this managed? How do you diagnose that somebody has? Apart from the symptoms that the person will present with, how do you make a diagnosis? A definitive diagnosis.
Thank you. It's just like any other autoimmune disease, diagnosis can be very difficult because their symptoms mimic symptoms of other common conditions. And that's why you won't blame our colleagues that we diagnose Sjögren as malaria, or that we diagnose Sjögren as typhoid, or diagnose infection or upper respiratory tract, because for example, fatigue, for example, or joint or dryness might be due to some other things that are not Sjögren. So what we tell our colleague is that once you are managing certain symptoms that are not, patients are not getting better, or you cannot explain the symptoms, you might need to refer to a rheumatologist, as long as it's not surgical conditions. Okay. Now, how do we diagnose? We look at those symptoms. They talk about dryness of the body, the mouth, the throat, the eyes, the skin, the dry private parts. Look at fatigue, and look at pain or joint pain or body pain. Sometimes they may have swelling of their parotid glands. That is like in the mumps. Not that they have a mumps, but it's just like a mumps. This place becomes swollen, the jaw swelling because of inflammation. Sometimes they may have joint pain as well, or joint swelling. And if internal organs are affected, they may have nerve complaints, like what's called neuropathies. They may have lung complaints like cough, just shortness of breath, difficulty in breathing, chest pain. They may pass a lot of urine at night, what's called polyuria, excessive urination. Then if it affects their brain, they may have seizures. Multiple complaints. They may have nerve, palsy. Now what we used to do, there are some blood tests we use to confirm diagnosis. There are some antibody tests. It's an autoimmune disease. Yeah. It produces antibody that fight the body. So there are antibody tests that are specific for Sjögren. One of them is a big medical word, pardon me, anti-Ro SSA, that's one antibody. Another antibody is anti-lysis. They are blood tests. We run it in our patients. Most of the time, these blood tests are usually positive in those that have high clinical likelihood of having Sjögren. So we don't just ask for this blood test anyhow. Because it may be positive, it doesn't say it's Sjögren. And it may be negative, it doesn't rule out Sjögren. So the most important thing is having high index of suspicion, clinical suspicion that this is likely to be Sjögren. By the time you ask for the test, it's likely to be positive. But the gold standard to diagnose is to have to do a biopsy. We call it lip biopsy.
Biopsy?
Yeah, you take our lower
For
lip.
dryness of the
yes,
mouth?
you take a biopsy, just small, and then send it to the lab. Look at it under microscope. So it will show you the inflammation, how the inflammatory cells enter the glands, all those secretory glands. So that is the gold standard, to diagnose Sjögren. Apart from, it also involves multidisciplinary. Sometimes we refer to ophthalmologists to assess the eyes for dryness. These are what called Schimmer's test. They put a litmus paper on the eye to look at how the rate of tear production in our eyes. There's a particular tear that we must produce in 1 minute. If you produce less than that, it might suggest dryness of the mouth. There are some fluorescent tests, of the eye. Because fluorescent tests that can be done to assess dryness of the eyes as well. For the mouth, you can do can send to dentists or oral physicians. Those ones we do, you can do a form of X-ray called cyalography to look at the ducts, that is the tract of the glands. They can also do manometry, target the patient to spit saliva into a particular cup that is graduated to look at the level of salivary production. So it's a multidisciplinary. Ophthalmologists are involved, oral physician or dentists are involved. Rheumatologists are also involved. So, but rheumatology is a cornerstone because the background problem is what? Is the autoimmune disease. So when we do all this with the symptoms, with the signs, with the blood test, with the biopsy, all this will help us to arrive at a definitive diagnosis.
And you have the facilities for
yes,
this?
Sure. We have the biopsy is usually done by the oral physician, and they have the capacity to do that, expertise to do that. The antibody tests, most of them are actually outsourced. We have a lot of labs that we have partnered with them. We outsource them. Some of them are not done locally. It takes like 15 days to have the result.
Oh, wow.
And there are some smaller tests like kidney function tests, because to assess their kidney function, liver function tests, the blood counts, the test to assess inflammations. All these are done together. Then if you are suspecting organs involvement like lungs, you can do a CT scan of the lungs. Depending on the organs you feel that it is attacking or it's affecting, you have to investigate that organs. And if you are suspecting that it is a secondary type, that is due to some other background disease, you have to investigate that background disease as well. So it is something that can be diagnosed. It's just that sometimes patients present late.
So now you talked a whole lot about this autoimmune disease and the reasons why some people may present late. Of course, because of their environment and not knowing that just ordinary dry eyes and dry mouth is as a result of Sjögren syndrome. And of course, the doctors probably would have treated for other disease conditions and not probably even remembering that it is Sjögren syndrome because it's not common for us to see as physicians. Now let's go on to management. How do you manage these patients when they come?
Yeah, thank you so much. So one of the reasons why one need to diagnose Sjögren is that Sjögren is a pre-malignant condition. What I mean is that it can herald a cancer, particularly cancer of the lymph node, what is called non-Hodgkin's lymphoma. So if patient has Sjögren for many years and the patient is not diagnosed or poorly treated or poorly managed, that Sjögren can transform to lymphoma, which is a cancer. That is one of the reasons why Sjögren need to be diagnosed, identified, and treated. Because if it has transformed to lymphoma, which is a complication now, the treatment might not be easy. Sometimes, particularly in Nigeria, where things are very difficult for a lot of people now. Another complication that we don't want to happen, it can affect for the blood vessels, which is called vasculitis. Inflammation of the blood vessels can affect and cause poor blood supply to different organs in the body. We don't want this to happen. Now, what are the treatments? They are what we call medical and non-medical. The non-medical is more of lifestyle. We talk about avoiding things that can also make dryness worse. So, if you are on drugs that or you are taking all these cold anti-cold or the congestants, you have to avoid it because they can also make dryness worse. If you are taking diuretics and they are not mandatory, you will need to avoid diuretics. Or if you have any drug that can make dryness worse, stay away from it. Or you must ensure that you keep yourself hydrated most of the time by drinking a lot of water. Humidifier everywhere. Make sure that you keep yourself cool. And you can even have multiple showers during the day if it is possible for you. You can have showers before you sleep at night. Make sure that you lubricate your skin, with moisturizer or emollient. Keep your skin or hydrated or oily. Apart from that, your mouth as well. Drink a lot of water. Then there's a tear drop or that you can also put in your eyes. Then there is a salivary substitute that can also be used to also help to stimulate a lot of fluid in almost lubrication in the mouth. Then if you avoid anything sweet in the mouth, because anything sugary, chocolate, sweets.
Really?
All these things can increase the risk of what? Dental caries. And juggling itself, drying of the mouth can cause jungle. So anything that make cause that, you have to avoid it. If you want to chew gum, there's a non-sweeting chewing gum you can use. Because all this can help, salivary production. There are some tablets you can also prescribe that can also improve both tear production and also salivary production in the mouth. That we can we call them it helps secretago, that they help to increase secretion of the fluid. I don't want to talk about that in public, so because to avoid said medications. Then if patient has other complaint like joint pain, they can sometimes we place them on drug that help to regulate their immune system. It's overactive immune systems. Yeah. So we have medication that can help to reduce, to regulate or reset the immune system. So we place them on immunomodulators. There are a lot of them. We don't want to talk about them. Then if it affects the internal organs, we also treat we're using some medication that help to regulate the immune system as well. Because that's the primary problem. And if we also make sure that we monitor complications, because as we are treating them, they are coming for follow-up. Our purpose of follow-up visit to monitor for complications, both side effects of medication they are using, as well as complications that the disease that cause. So there are some tests we do and everything like that. So generally, the another problem with jogging is that the jogging is the cause of chronic pain. Then we believe in chronic pain, because particularly if they are not unexplained, and they may become drug dependent. They have used cannabis before coming to you. They have used a lot of hard drugs because they want to reduce pain. Meanwhile, they never knew the cause of pain. Jogging can mimic fibromyalgia, honestly, the body pain. So that's another thing we need to look at. So psychiatrists sometimes, or psychologists or therapists, they also involved in management. So sometimes to desensitize them from prolonged exposure to drugs and everything. They are also prone to fatigue a lot. So the fatigue sometimes can be difficult to treat. Even with medication, with jogging drugs, fatigue may be refractory to treatment. So sometimes they need some aerobic exercise, meditation, and all those things to help their fatigue, and some psychological, counseling and everything like that to improve fatigue.
Wow, Dr. Lan,
thank you.
It is actually an unusual cause of dry eyes and mouth. Sjögren syndrome affecting the whole system. Well, I just can't thank you enough for being part of our program today and letting our viewers know about this syndrome. It's probably going to be strange to them because they haven't heard about it before. And I really appreciate you for coming, and we look forward to hosting you again, having you as our guest to tell us more about other autoimmune conditions. Really appreciate you. Thank you so much.
Thank you.
And to our viewers out there, thank you for being part of today's episode. We talked about Sjögren syndrome, the unusual cause of dry eyes and mouth. And he did say that it is a syndrome. It's caused by a chronic autoimmune disorder that actually destroys the moisture-producing glands. Talking about moisture-producing glands, remember your eyes, remember your mouth. So the eyes, the tears, the glands are no more working effectively. So for you to even tear, it's difficult. You don't have tears. And the saliva production is usually less. I hope you benefited a lot from today's episode. My name is Dr. Martina Agbere. You'll be kind enough to follow us on our social media platforms. And if you want to be part of this program, just send us an email. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.